In a professional clinical environment, saying a patient simply caught a cold or got sick is dangerously imprecise. To operate at a C1 or advanced academic level, you need vocabulary that describes exactly what a pathogen is doing. Today, we are upgrading your clinical English by mastering 4 highly specific infectious disease terms. We will break down clinical usage, trace their Latin origins, map out precise antonyms, and lock them into active vocabulary with a versant shadowing exercise. Because in medical science, applying the wrong verb can completely misrepresent how a disease spreads through a population or behaves inside a host. Step 1 is replacing the casual concept of catching an illness with the formal term, contract. The word originates from the Latin prefix con, meaning together, and the root tractus, meaning to draw. When a patient contracts a disease, they are metaphorically pulling the pathogen toward themselves. You must learn to distinguish contract from its synonym, acquire. We use contract almost exclusively for negative outcomes, like an infection. We use acquire for broader, often positive biological gains, such as acquiring immunity through a vaccine. Conversely, a strong immune system attempts to ward off potential infections. This antonym describes the active defense mechanism of keeping a pathogen out entirely. Choosing contract over catch instantly demonstrates a C1 level understanding that the patient has become an involuntary host to a specific pathogen. Once the host contracts the disease, the narrative shifts to the internal cellular battlefield. To survive, a virus has to enter a healthy cell. This diagram maps viral replication. In steps 1 and 2, the virus gains entry. Moving to steps 3, 4, and 5, we see the unauthorized seizure of the cell's machinery. The precise term is hijack. The virus hijacks resources to manufacture copies. Originating as 1920s slang for a robbery, hijack carries a criminal connotation. This makes it distinct from Commandeer, which implies an official or military requisition of supplies. The opposite action is to relinquish or voluntarily give up control. Once a pathogen integrates into the host DNA, it rarely relinquishes that control on its own. Hijack works perfectly here because it exactly describes the parasitic, unsanctioned theft of host resources. Stepping back from microscopic biology, we have to look at how populations react to these outbreaks. In a crisis, fear reliably generates false information. The term for this is a misconception, an incorrect opinion relying on faulty thinking. During outbreaks, a common misconception is the belief that viruses like Ebola are airborne, when they actually spread through direct fluid contact. Be careful to separate a misconception from a fallacy. A misconception is an innocent misunderstanding. A fallacy is a structural failure in logical reasoning. In public health operations, clearing up widespread misconceptions is an essential countermeasure, matching the importance of treating the infected patients. Some threats appear defeated, only to return years later. Diseases like tuberculosis are classified as re-emerging. The specific noun for this return is resurgence. It combines the Latin prefix re, meaning again, with surgery, to rise. The threat is actively rising up. This active, rising state stands in direct contrast to its antonym, dormancy, a quiet, latent period where the virus remains present but completely inactive. You might also encounter the synonym recrudescence. Reserve this highly specific clinical term for negative events, like the severe relapse of an infection. For global health officials, labeling an event a resurgence rather than a novel outbreak dictates an entirely different set of deployment protocols and containment strategies. Now that we have the vocabulary, we use a technique called silent shadowing to lock these C1 terms into your brain's logical structure. Take a look at this practice text. At every slash mark, you must mentally pause and confirm the exact meaning of the preceding chunk of words before moving forward. Listen to the rhythm. What makes Ebola so feared is that it targets several different cell types. Let's test your instant translation. Using that exact syntax, what makes X so feared is, build a sentence right now explaining why global warming is a threat. Here is the C1 level translation. What makes global warming so feared is its potential to cause irreversible damage to the ecosystem. You now have 4 precise tools: contract, hijack, misconception, and resurgence. To submit your upgrade, pick one of these terms and use it to describe a recent news story in the comments below.